Well, thank you, Kojo. You're putting me on the spot. Wow. It's good we're having this particular conversation regarding healthcare and the different types of or the different approaches to healthcare. I think traditionally the focus has always been on curative medicine, and we've paid relatively little attention to preventive and then promotive health. So it is a call in the right direction. I believe every healthcare professor, every doctor will support it because from where we sit, most of the time in the clinical space, then you don't want late presentation of disease, or you don't want to be treating patients when they have developed complications of the disease. It makes your outcomes very, very poor, and it makes the work a whole lot difficult. And you don't want either of these two options. So, Kojo, let me talk about the health-seeking habits of the Ghanaian. And this April, I've been doing this work for 18 years. So I know a bit about the health-seeking habits of the Ghanaian. I think earlier in the on the show, Raymond perfectly described the male adult Ghanaian as health-seeking habits. And it's very, very different from the female adult Ghanaians' health-seeking habits. I think we need very good research to understand why the differences. Because, Kojo, when it comes to the health-seeking habits, the men are relatively financially empowered, and adult females, don't have the same economic or financial muscle as their male counterpart. So you will think that since healthcare has cost implications, the men would rather jump at it and frequent hospital more. But in all of my practice, every month I look at the statistics in the 9 years of Medical's hospital. It is overwhelmingly female attendants higher than male attendants. So the health-seeking habits of the Ghanaian ought to be better than what it is right now. I was trying to send a picture, and I'll try maybe later on if we have a break, try and find the picture for you. But Kojo, it's a picture of what we see with breast cancer presentation typically in this country, with the entire breast completely ulcerated. I've seen breast cancer with maggots coming out. The late presentation, I think last year, we all got to know a bit more about chronic kidney disease. And again, we get to see patients coming in with stage 4, stage 5 kidney disease. In that stage, and that's the terminal stage. Stage 5 is what we call end-stage renal disease. When patients come in at that stage, then there's very little to do. Then we'll call on dialysis, which is very, very expensive. So last year, for example, that whole conversation about dialysis typifies the need for us to focus a lot more on preventive health. The attitude needs to improve. In my experience, most of the time I'm told, doctor, the intimate yari, na me nko hospital, na doctor bi go kan tell me say yari bi wo ho. Yeah, you say me yari, intimate nko. Well, that's the gist. That's the summary of the attitude for most. And we need to change that through health education.
Thank you.